Good morning, everyone, and thank you for joining us here today. I'm holding this press conference to address the recent developments related to the Bermuda Health Council Amendment Act 2024, which passed in the House of Assembly on the 3rd of May, 2024. As you would recall, the Bermuda Health Council Amendment Act 2024 made provisions that will expand the collection of important health system data to ensure stronger and more timely health policy, make more effective delivery of health services, and improve population health outcomes. The bill is a critical step to fulfilling our 2023 speech initiative to support data collection to control medical co-payments for our vulnerable population. We have heard from many persons who are struggling with co-pays, and the government is determined to deliver on this promise to ensure that Bermudians are not excluded from receiving vital primary care due to the inability to meet the co-pays. Primary care is essential to catch medical issues early to ensure early, timely treatment. Also, as we continue towards universal health coverage, accurate data to enable evidence-based and informed decision-making is essential. One of the key weaknesses of our healthcare system in Bermuda is that we do not have the necessary data to inform the decisions that are needed to make healthcare more affordable in Bermuda, and this has been pointed out in numerous reports over the last decade. The government has a responsibility to act and to ensure that we are listening to the experts and advancing reform that is informed by data. While many agree of the importance of data collection, the inclusion of a penalty of imprisonment for non-compliance provoked concern and reservations from valuable stakeholders in our physician community. We have actively listened to the concerns that they've raised and the suggestions raised since the passing of the bill in the House of Assembly from all sides, and in the spirit of collaboration, the government will amend the bill in the Senate following representations made by legislators, members of the public, and some of our healthcare providers. We believe that the proposed amendment reflects our dedication to inclusive and responsive governance. By incorporating feedback from our colleagues, we look forward to the passage of this bill in the Senate as a key measure to advance and progress our goal towards universal health care. The proposed amendment to be laid in the Senate, which will remove the penalty of imprisonment, will be incorporated to ensure that Bermuda can achieve its intended goals, namely the collection of anonymized data in a manner that is focused and authorized, all to improve health outcomes and enhance financial sustainability and affordability. It is important that I reiterate at this time that no personal medical information will ever be requested by the Bermuda government or the Bermuda Health Council. This is all about promoting better population health outcomes. This change demonstrates our commitment to considering diverse perspectives and working together for the betterment of our community and nation as we jointly move towards universal health care. I believe that the proposed amendment strengthens our objective towards better data collection, and I am optimistic about the positive impact that it will have. I'm grateful for the constructive feedback and cooperation we have received from our stakeholders in the medical community. Universal health care is not easy, but it is a worthy goal that is shared by most Bermudians. Too many in our community go without the necessary care at an early stage, which leads to more expensive health care at all residents. By ensuring that persons have access to care that they need at an affordable price, we can achieve the goal for healthy populations, ensuring that we have healthy people in healthy communities. Thank you.
Minister, we'll now take some questions from Sarah Lakin at the World Gazette. Sarah?
Thank you, Minister. Couple of further questions. So you did receive some recommendations from the Bermuda Medical Doctors Association. There were some concerns, and I'm glad to hear that the imprisonment one has been addressed. I believe that they still were concerned about the excessive penalties, so the financial side of things Is that how you understand it? And will that remain the same?
It will remain the same. The penalty with respect to the fine is
Yeah.
consistent with provisions that are already existing in the legislation. There was more of a dissatisfaction as it relates to the terms of imprisonment, which again is what will be the subject matter of the amendments in the Senate on Wednesday.
But were they still concerned about the monetary value of that penalty?
Some were and some weren't. But I think what's more important is for us to recognize that this is all about population health data, and that if there are institutions that are unable to provide that information that's being requested, then perhaps because they have limited resources and the like, then the Health Council as well as the ministry will be able to provide assistance to them so that they can provide the data that's being requested that is certainly desired to help to improve our population health outcomes.
I think there was something they said they wanted the words without reasonable excuse slotted into the act. Is that, did you do that?
That was certainly one of the suggestions that was made, but we think that the way that the act is written, and in particular removing the penal notice as it relates to terms of imprisonment for failure to comply, is certainly going miles ahead of where we were, and it certainly, I think, will satisfy all stakeholders because the main issue was as it relates to the terms of imprisonment.
Sure, okay. And presumably this is why it didn't go through the Senate as planned previously?
We were having further consultation prior to that. You'll know that the Senate can debate on their own timetable, but we were having further consultation, which is why it was not taken up at the Senate at that time.
Sure, okay. You did touch on personal privacy and commercially sensitive information there, but were any of the recommendations put forth to you by the Medical Doctors Association taken on board in terms of more protections being put in place, I believe they were?
Yeah, one of the concerns that they did raise was with respect to privacy. And as we've indicated previously, there will be no personal patient information requested. Health Council are always compliant with HIPAA, and they've been for 2025. Amongst other agencies have been fully engaged with HIPAA, and they will ensure that whatever information is requested, that they will be they will abide by the provisions of HIPAA, notwithstanding that it's not even legislative yet enforceable until January 2025. So they are totally committed to ensuring that HIPAA provisions are adhered to. And again, I must emphasize that no personal patient information will ever be requested with respect to this data. It is high-level population data that we're requesting so that we can make better informed decisions as it relates to improving health outcomes. One of the strategic goals of the health strategy of 2227 listed 8 strategic goals, one of which was, of course, UHC, which we're on that trajectory for, but the other one was to ensure that we have starting points and knowing our data. So as such, we commissioned a joint strategic needs assessment, and regrettably, one of the findings of that was the lack of data that Bermuda has currently.
Okay. Are there any concerns about any data breaches? I mean, just in light of cyber attacks and things like that?
Clearly, that is always a concern, and the Health Council have certain firewalls and other types of technical equipment. I'm not a techie, but they have whatever is necessary to minimize that. However, again, I need to emphasize that no personal patient data will be asked for. It's all high-level population health data. What percent, I'll give you an example. The type of data that we might be asking for is health-related risk behaviors. What are the smoking rates of your clientele or your patients? What are the physical activity rates of your patients? What's the prevalence of diabetes of your patients or hypertension? All of it will be anonymized. No private personal information regarding the patient will be asked for. It's high-level population data that we'll be requesting.
Okay, just finally, were there any other of the recommendations that were put forth to you taken on board from the Medical Doctors Association?
One of the other recommendations that they were concerned about the term of imprisonment, as I've spoken about.
Yes.
They were concerned about PIPA, and they were also concerned about a data sweep. But as I've indicated previously, in addition to the data that's going to be requested, it will be all anonymized. It will all form high-level population health data. The Health Council nor the government has any interest in just asking for data, because we don't have the resources to collect it or to analyze it. But what we do need is targeted data to assist us in not only driving down co-pays, which was a throne speech initiative in 2023, but also to ensure that we have better health outcomes. We spend far too much money as a country on healthcare costs, and we have poor health outcomes. Our number one objective is to increase and improve our health outcomes, and the way we can do that is by making informed decisions based on data.
Okay, and just finally, do you have a timeline on when you'd like to get this data by?
Well,
Start implementing these policies?
it is anticipated that it will be going to the Senate on Wednesday, and I'm hopeful that it will be successful. And then from there, the process will begin insofar as the type of data that will be collected, but it will be a collaborative effort. The Health Council will meet with our stakeholders. For example, let's say that the issue is diabetes, which we know unfortunately is very prevalent here. And they'll meet with the stakeholders and say, this is the type of information that we're requesting. What say you? And there will be a collaborative approach. And then following that process, then they'll write to me. And as under Section 7, I can direct the Health Council to direct that stakeholders provide us with the prevalence of diabetes. But it will certainly continue to be a collaborative effort.
Yeah, and any idea how long it will take to get all this data? And
It's
just an ongoing?
it'll be iterative, of course.
Yeah.
If we notice that in 6 months from now, God forbid, there seems to be a prevalence of this particular ailment in Bermuda, then we may need to require data to address that. And once we have the data, we can make informed decisions. It might be spending more resources on prevention of that ailment, but it will be, it's a constant, it will evolve depending on what our health outcome needs are in Bermuda at the time.
Okay, all right, thank you.
Thank you.
Thank you, Sarah. Minister, do you have any final remarks before we end?
No, I just thank everyone for participating. I thank you particularly for the input that we received from members of the public, the medical community as well, and I'm looking forward to a passage of this, and in particularly the ability for us to collect data so that we can make better decisions as it relates to our health outcomes in Bermuda.
Thank you. Thank you, members of the media. Thank you, Minister.
Thank you.